Dr. Kenny Levine, welcome back to Health Talk. I'm here with Dr. Anthony Pannozzo. Tony, before we get beyond this, because my wife suffers from migraines, tell me a little bit about what your treatment does for that.
Well, first of all, you have to understand that when neurologists treat migraine, they're not treating a specific structure. They're treating what I call air. A headache is just a symptom. So when you look at it this way, a headache is a symptom. And if you know where that symptom arises, then it can be treated directly. So that's what we do. Like, for instance, real migraine is actually a COC1 joint right at the top. Can you see that? It's way up there. We use the fluoroscope for that. And it's one shot, and it comes right out.
Let's talk about something that's kind of important down here in South Florida. Okay. Everybody comes to South Florida, they want to be outdoors all day long. They want to be able to play golf. They want to go swimming. They want to be able to play tennis. Tell me how your procedures relate to sports injuries.
Well, sports injuries are like any other injury. It's the same injury whether you fall down steps or get hit in a 90 or 30-yard line. It doesn't really matter. It's how you approach it, how fast you can treat it. And we don't like bench time. We don't like whirlpool. Doesn't do you any good. Drugs are not good either because they don't treat the area except steroids. So we approach it in a cause and effect relationship. If you're limping, we got to find out why you're limping. It's usually a knee or a hip. It could be a lower back too. So any of those things. Anything you have in mind? I mean, golf is the same way.
Well, let's talk about me.
Okay.
I've had 2 surgeries because of golf. One was an elbow. Mm-hmm. I had a lateral epicondylitis. If I was a tennis player, it'd be called tennis elbow. Okay. I tore a rotator cuff. Mm-hmm. And both of those things back then were treated with surgery.
Right.
Tell me how you would approach it.
Well, we use the fluoroscope to analyze the movement of the shoulder. And there is always a scar tissue in there. That's why it's limited in the range and hurts.
Right.
So when we isolate that, we just inject it and it comes right out.
What if there's a tear?
Well, we don't really believe in tears. I mean, I don't know how you can get a tear. Tendons are too tough for that. You can get a sprain, which is a pull on the bone, but that's about it.
So you don't see a rupture of the tendon or no ripping of the tendon?
No.
And what about a tennis elbow?
Tennis elbow is the same thing. It's another joint. So we have an approach for that. Using the fluoroscope, we can isolate the part of the elbow that's really painful. Mm-hmm. Now, they're not all the same.
It was right here. I know exactly where it was.
Now, it could be muscle only, or it could be joint and muscle, or just joint.
Well, let's talk about it, because if I wore an air cast to put the pressure on here, it felt better.
Yeah.
So what do we know what that is? Is that
there's no motion.
Okay. Yeah. All right. Are there patients that you see for whatever it is, and you say to them, I can't help you? What things can't you help?
As far as the pain is concerned, I haven't seen any that we couldn't help.
Okay, so people have pain from the top of the head to the hips, or in their knees down to their ankles. So from the top of the head down to the bottom of the feet, exactly as I began the show. You have a procedure that can identify the problem. Through your procedure, you inject the problem, and they can walk out within several minutes and feel.
Yeah, most everybody does. In fact, I would say probably 99% do.
Okay, and from what you told me, what I asked before, you don't have to go back to that specific site again.
That's right.
Is there a limit as to how many, well, you talk about not going back to the specific site, but I know people have had steroid injections for joints and they're told they can only do it 2 or 3 times.
Well, first of all, that comes from old literature from a British orthopedic surgeon who kept injecting the joint for 25, 35 times using the roughest kind of steroid there is. And of course the joint broke down.
Okay.
But the whole thing was false and it was fake because they didn't have the proper diagnosis, they didn't know what they were treating, and they published this paper. Now, everybody and their uncle repeats this over and over and over again. I read the original paper, and it's...
And you didn't write it, though?
No. No.
Well, I know when I began my practice, before I had a large staff, before I had a hygienist, I was doing a lot of scalings, and I got a hot knuckle. And there was an orthopedist across the hall, and I can still remember the day he injected my my knuckle. So these things could be quite uncomfortable, right?
You can inject the joint capsule, but not the joint itself. We never inject the joint inside the joint, any joint.
Okay, we're going to get back to the specifics of that, okay? We're not going to go in the joint, we're going in the capsule. It's Dr. Kenny Levine with Health Talk. We'll see you in just a moment. Thank you.